Nursing datasets and information management are two areas that have become a driving force to improve patient outcomes and assist in the delivery of safe, effective, and fiscally conscious patient care. The formation of a universal nursing language that can be used to aid in the sharing and management of patient information across the ever-increasing technological healthcare world is of utmost importance in the battle to provide safe patient care. Through information management practices that combine with non-nursing diagnosis and nursing intervention and outcome data sets such as NIC and NOC, we can make available to all practitioners an effective way to communicate and plan patient care. Nursing diagnoses communicate the professional judgments that nurses make every day to our patients, colleagues, members of other disciplines and the public. Nursing diagnoses define what we know, they are our words. Implementation of nursing diagnosis enhances every aspect of nursing practice, from garnering professional respect to assuring consistent documentation representing nurses' professional clinical judgment, and accurate documentation to enable reimbursement. NANDA International exists to develop, refine and promote terminology that accurately reflects nurses' clinical judgments. NANDA International is a global force for the development and use of nursing's standardized terminology to ensure patient safety through evidence-based care, thereby improving the healthcare of all people. The Nursing Interventions Classification, NIC, and Nursing Outcomes Classification, NOC, are comprehensive, research-based, standardized classifications of nursing interventions and nursing-sensitive patient outcomes. These classifications in conjunction with NANDA 1 diagnoses serve as the foundation for nursing practice, education, and research wherever nurses practice. NIC and NOC are included in electronic documentation systems. NIC and NOC are used to test the efficacy and effectiveness of nursing interventions in multiple settings. The NIC classification includes the interventions that nurses do on behalf of patients, both independent and collaborative interventions, both direct and indirect care. While an individual nurse will have expertise in only a limited number of interventions reflecting on her or his specialty, the entire classification captures the expertise of all nurses. NIC interventions include both the physiological and the psychosocial. The Nursing Outcomes Classification, NOC, is a comprehensive standardized classification of patient/client outcomes developed to evaluate the effects of interventions provided by nurses or other healthcare professionals. Standardized outcomes are essential for documentation in electronic records, for use in clinical information systems, for the development of nursing knowledge and the education of professional nurses. Each outcome has a definition, a list of indicators that can be used to evaluate patient status in relation to the outcome, a target outcome rating, scale or scales to measure patient status, and a short list of references used in the development and refinement of the outcome. The classifications are continually updated to include new diagnosis, interventions, and outcomes whenever the need arises. This way all three systems work together to drive nursing care and improve patient outcomes.
Created using Powtoon.